Hi, my name is Melanie, and I just want to share with all of you my cancer story. I was diagnosed with chronic lymphocytic leukemia in September of 2013. I was only 49 years old at the time, which is much younger than the typical age to be diagnosed with a chronic blood cancer. My cancer was found very randomly. I had ended up in the emergency department for a totally different reason, and of course they did routine lab work, which they typically do, and it was found that my white blood cell count was elevated at that time. It was in the 20s, and my lymphocyte count was off as well. So at that point, even though I'd been in for a different reason, I was referred to an oncologist to follow up. They did FISH testing is what it's called, and based on those labs I was diagnosed with the leukemia, and I was in the watch and wait phase of the diagnosis at that point. What that means is you keep an eye on your lab work, kind of pay attention to your symptoms, and I really didn't have any symptoms at that point that I was aware of. I had some hot flashes that I attributed to menopause, of course, based on my age. So I kind of thought, well, maybe that could be a symptom. What ended up happening then, the severity of the hot flashes and the frequency had changed, and I was kind of noticing them to become more of night sweats. So at that point it's like, okay, now something is a little bit different here, and maybe I am having symptoms, and I just really wasn't aware of it. I was shocked to learn that I had the C word, the cancer. Like, I'm only 49 years old, and I, of course had children, and I was hoping to see them grow up and get married and have grandchildren of my own. So it was definitely not a very happy time for me. Was concerned and did a lot of research and wanted to see kind of where things would go from here, especially since I was pretty young to be diagnosed. There's really no cancer in my family. There's some breast cancer, and really no other cancer, so kind of just interesting that it just kind of randomly happened. But that's kind of what happens, I guess. People get cancer and you sometimes have no reason. Fortunately, I have a very, very good support system. I have my family, I have wonderful friends, and my coworkers are amazing as well. Just kind of keep an eye on things and making sure that I'm doing okay. So in March of 2019, my white blood cell count had gone up as high as 113. And it was kind of determined that the night sweats had gotten worse. I was kind of trying to deny that and blame it on the hot flashes, like I mentioned, but they had definitely gotten worse. So based on my labs and the symptoms, along with my oncologist and my family, we decided it's time to look at doing treatment. The treatment that we chose is a medication called Imbruvica, and it's frequently used for the leukemia. It is one of the newer medications, but it is used frequently for chronic lymphocytic leukemia. It has minimal side effects. Initially when I started it, some fatigue, diarrhea, and a little bit of loss of appetite, but really it is tolerated very, very well, and I'm very fortunate to have that. I know initially when we looked at starting this medication, that was like one of the biggest shocks, was that I looked and read online, which I probably shouldn't have done. I should have just talked with the doctor a little bit more, but looking online, that cost per month was going to be well over $1,000 a month for the medication. So I was like, oh my gosh, I mean, I just want to look into retirement and not have all my money going toward medication, but we'll deal with it. But then as I looked into it, fortunately, I have health insurance, and these companies have something called a copay program, and you sign up for a copay program, and my medication is only $10 a month through that, since I do have the insurance. So I'm very, very fortunate, and that was something I'm very, very thankful for. So I feel like they've made huge strides in the medication that's available for leukemia, and obviously for many of the other cancers as well. So daily they are doing research and having many options for people to have treatment, and huge survival rates. I don't even really think about a survival. I mean, I'm definitely thriving, and I'm working full time, and I have a great family, and things are going well. My follow-up is every 3 months I see the doctor and have my labs drawn, just to keep on top of things and keep an eye on how things are going. Most days are great. I maybe have a little bit of fatigue that I still deal with, but other than that, things are great, and I'm very fortunate. So that's kind of my story on dealing with my cancer diagnosis. As future nurses, I would just say that remember to be the kind and caring, compassionate people that you are, and that's the reason you're wanting to go into this profession, and you'll do a great job of taking care of your cancer patients and anybody else. So I appreciate the opportunity to share my little story with you, and I wish you well. Thank you very much.